So the American Heart Association has a division called the American Stroke Association, and that really embodies the things that we do for stroke. The Heart Association for many years has had a focus on stroke because stroke is a cardiovascular disease. It involves blood vessels that bring blood to the brain and the problems that can happen in the brain because of stroke. There are two main kinds of stroke. Ischemic strokes, where blood flow to the brain is blocked, most oftenly by clots or atherosclerosis or a combination of them. Clots can come from other places, but often they occur in the arteries in the neck when they're affected by atherosclerosis. They can form in the heart when there's atrial fibrillation. They can even form in other parts of the body, and occasionally, if you have the right sort of setup in your heart, they can actually travel from the veins across to the left side of the heart and up to the brain. So all of those sorts of circumstances would cause an ischemic stroke. And those are the kind of strokes for which patients need to quickly get to hospitals and have clot-busting medications or TPA given. Because if we can dissolve that clot, we can make a big difference in how severe the stroke will ultimately be and how much it'll affect the person and their functioning. The other kind of stroke is a hemorrhagic stroke, and there, for several different kinds of reasons, you actually have bleeding into the brain tissue. So it can be equally serious, can be more serious. One can die from either kind of stroke, but obviously if you're having bleeding into the brain, we don't want to give medicines that keep you from forming clots. So it's a critical differentiation when someone comes to the hospital with a stroke, whether they're having a stroke due to a clot or a stroke due to a hemorrhage or bleed. And that's the reason that we rush them to CT scanning, and we have to have people available 24/7 to be able to read those films to know if they should get clot-busting medicines or if they absolutely should not get them. If they should get them, they can make a huge difference. If we're giving them to somebody who's already having bleeding, we obviously could make things much worse because the body's ability to close off that bleed by clotting would be critical to the person. Sometimes bleeds in the brain are associated with really terrible headaches, the kind of headache where someone says, "This is the worst headache I've ever had in my life," not just an ordinary headache like we might all get. And that's why the symptom of the worst headache you've ever had is one of the critical symptoms of stroke that we say people should go to the hospital with. And the headache may be really severe even at a time when your functioning isn't otherwise affected. So, a very, very severe headache is something that should take you to the hospital, as well as, of course, all the symptoms that we can have when we have a stroke. It's really important for AHA staff and really for the public in general, of course, to know what to think about in terms of the symptoms of stroke, because many times in a stroke, and in particular with some kinds of stroke, the patient doesn't recognize that they're having a stroke. So stroke in some parts of the brain can affect your function significantly, but can also make you not know that your function is affected. So it's a very strange sort of phenomenon. The patient will, you may be sitting and talking to a patient, and if they have this kind of a stroke, maybe they put their glasses on and they put them on wrong because they don't know that part of their face is there. Or they don't put them on with one hand, but they don't realize they're not using that hand. And if you tap on both their hands, they may feel like you're only tapping on one hand, but they don't know that they know that. So it's very important to realize that patients can have symptoms of stroke that you as a bystander would know that they should go to the hospital for, and they would have no idea. So since stroke can affect any part of the brain, it can affect any of our functioning. It can affect motor functioning, like being able to walk or grab things, pick them up. So we ask people to hold their arms out or to raise their hands up, that sort of thing, to see if they're having a problem with functioning. But someone who has trouble with walking, likewise, the issue of stroke should come to mind. If the stroke affects the cerebellum at the back of the brain, then it'll affect balance. And so if someone suddenly is staggering or not able to keep their balance, sometimes that has very benign inner ear causes, but it can also be a stroke, so that's very important. If someone can't speak, if they're having a problem in the part of the brain that affects speech, so they're either not able to make words, so they're talking, but you can see that they're slurring their speech, or they actually are talking gibberish. The words are not the right kinds of words in either of those cases. Or if they don't seem to be taking in what you are saying to them, then that can be affecting either the sensory parts of the brain so that they're not taking language in, or the parts where they express it. In either case, those can be important signs of stroke. And then numbness in an area, so again, sensation, which can affect any of our senses, but in often what we'll see is someone feeling numb in some area, a hand or a foot or an arm or a leg. And any of those are reasons to take people to the hospital. Confusion, problem with vision can also be seen because the tracks in the brain that come from our eyes back to the back of the brain where we see are long and can be affected by stroke in many places.